Then comes your nasogastric tube, again very important from our exam perspective. The nasogastric tube is also called as the Ryle's tube. The average length of the Ryle's tube is going to be 100 centimeters. It is used to decompress the stomach, as well as if you're looking to feed the patient for if the feeding requirement of the patient is less than 2 weeks. If the feeding requirement is less than 2 weeks, you can go with Ryle's tube. If the requirement of feeding is more than 2 weeks, then you have to look for feeding gastrostomy or a feeding jejunostomy, right? So with Ryle's tube, you can only feed for or maximum until 2 weeks. That is going to be considered. Now, another question that they ask you is, how do you measure the adequate length of the Ryle's tube to be inserted? That's your previous exam question. So to measure the adequate length of nasogastric tube. To measure the adequate length of the nasogastric tube that you have to insert, we standardly call it as the Nex Rule. We call it as the Nex Rule. Now, what is this Nex Rule, right? So if you look at this, a representation of the patient. This is the neck. This happens to be the thorax and the abdomen. And let's say this is where you have the Xiphi sternum. This is the suprasternal notch. This is the sternum. And let's say this is the Xiphi sternum that is there. So what is the Nex Rule is, if you look at the orientation, you take the Ryle's tube from the tip of the nose to the earlobe, from the tip of the earlobe to the Xiphi sternum. You measure the length. This is called as Nex Rule. Right? So Nex Rule is to, after you measure, this is the amount of nasogastric tube that you have to flush it inside the patient. This is what we call it as the standard Nex Rule. So nose to earlobe, earlobe to Xiphi sternum is what we call it as the Nex Rule.